Good morning, everyone. We're going to give it a few minutes to allow everybody to hop on the webinar, and we'll get started in about 1 minute. If you're just hopping on, we're just giving it about 30 more seconds to allow everybody to get into the virtual room, and then we'll get started this morning. Okay, well, welcome everyone. Thank you so much for joining us for our Doc Talk with Dr. Kohli from 9Health. We're so excited to have you with us today. Obviously, there's a lot happening around us in regards to healthcare. So this is an important conversation for our business community and community at large to hear, because there's a lot of concern and a lot of uncertainty. So we're thrilled to have such an incredible expert with us this morning in Dr. Kohli. I do want to note that there is an opportunity for you all to utilize that Q&A function at the bottom of your screen to put questions in there for us to be able to answer at the end. So we will be leaving 15 minutes, so please feel free to use that. We'll do our best to tackle the big topics we've heard from you over the past few months, but we know there's more that you'll need answered. So please feel free to engage with us that way. So we're going to go ahead and get started quickly here, because we are on a tight time frame this morning and have a lot to cover. So again, welcome, Dr. Kohli. We're so glad to have you here with us. So thank you.
Thank you so much for having me. It's my pleasure to be here with you all this morning. My name is Payal Kohli, and as you heard, I'm the 9Health expert. And I had the privilege of joining 9Health in January of this year, which was just about 1 month before the pandemic hit. And little did I know that I was going to be thrown into the midst of a global pandemic at a time like this. But as I said, it's really been my privilege to be here for the community, to educate everybody. And a little bit about my background. I'm originally from Colorado, so I grew up here, went to high school in Aurora, and my parents still live out there. And then I went to college at MIT, and then Harvard for medical school, Harvard for residency, and Harvard for my first fellowship, and then University of California, San Francisco for my other 3 fellowships. And after staying on both coasts, I realized that Denver is the best place in the country. And I came back home about 5 years ago, and I've been working as a cardiologist here in town for the last 5 years. Earlier this year, I did start my own practice called Cherry Creek Heart, which has also been quite a challenge to open a practice during a pandemic. But it's really a privilege to be here with you all this morning, and I'm really looking forward to answering your questions. I'm board certified in cardiology as well as internal medicine. So if you have any questions, whether it's about COVID, the flu, or anything else, please feel free to ask at any point. But we do have some questions to get us started today. Really the hot topic questions that have been coming up, that have been asked over and over again, that I thought I might cover this morning. So our first question is,
so we're going to start with this term, the Twindemic. What is this? We're hearing this floating around the media a lot. Tell us about the Twindemic.
So that's a great question. So the Twindemic is a new term that we just coined this year. And really what it is the confluence of 2 infectious disease outbreaks occurring at the same time. And this year, what we're referring to obviously is the influenza, which comes every single year, and COVID-19, which we've never had before, and that's a global pandemic. So now you may be asking me, why does it matter? So what's the big deal if 2 pandemics come together, or 2 infectious disease outbreaks come together? Well, there's several reasons that it matters. So the first is, if you think about influenza and you think about COVID-19, there's a tremendous overlap in the symptoms. So really by symptoms alone, you cannot distinguish the 2. So, fevers, cough, and shortness of breath are the 3 most common symptoms that we see in COVID-19. And if you've ever had the flu, you know that fever, cough, muscle aches and pains, and feeling under the weather is also very common with the flu. Now, you generally tend to have a little less shortness of breath with the flu because it doesn't involve the lungs as much as COVID-19 does, but it's really hard to tell because, as you've heard, different people respond differently to COVID-19, with some having more mild symptoms. So the reason it becomes relevant this year is because if you have symptoms this winter of fever, muscle aches, body aches, even if it's just a cold, everyone is going to think you need to be ruled out for COVID-19, which you do, and of course the flu. So the CDC has actually developed a test. With a single test, it can look for 3 different things: influenza, SARS-CoV-2, which is the virus that causes COVID-19, and another virus that causes a cold. So that's why it's such a big deal this year, because if you have these symptoms, you're going to have to be quarantined, you're going to have to miss work, you're going to have to stay away from your family, and then God forbid you're sick enough to end up in the hospital, you're essentially going to be treated as if you have COVID-19, unless the test comes back negative, which takes some time to do. So that's the first reason that the Twindemic is important. The second reason is because of our resources. So if you've got 2 bad things happening at the same time, and they're both pretty aggressive and they can both have mortality. We know people die from flu. We certainly know people die from COVID-19. And our hospital system can get overwhelmed very easily if a lot of people are getting sick with COVID-19 and the influenza, but we don't know which one it is, and they're ending up in the hospital. So we really need to do our part this year to decompress the hospital system as much as possible from flu admissions, which we can prevent, so that they can be better prepared to really handle COVID-19. So that's kind of the 2 main reasons why we worry so much about the Twindemic, is there's so much overlap amongst the symptoms. The 2 syndromes are similar, although obviously treated very differently. And of course, we don't want to overwhelm our hospital system. Earlier this year, when we were in the flu season in March, flu activity was going down when COVID was increasing. So we kind of were in the sweet spot. And in the summer, as you know, flu activity is very, very low, if not 0. But now we're headed at a point where both the flu and the COVID-19 activities are increasing. So we really have to be extra cautious in terms of how we proceed this fall.
That's great information. Thank you so much for sharing that. How do we protect ourselves? So knowing that that is the concern, what do we do to make sure we're safe?
So that's a great question. And this year, it's not just about protecting ourselves, but it's about protecting our neighbors or family and our community. So the first and most important thing you can do is to get that flu vaccine. And I say that again because of many reasons. So I call it the 3 S's of Dr. Kohli. So the first S is the selfish reason. You don't want to get the flu this year for all the reasons that I just said. You're going to miss work. You're going to be treated as if you have COVID-19. And, it's just a preventable disease. So why increase your risk of getting that? The second S is the selfless. So we want to decompress that hospital system like I talked about. And in a regular year, only 35 to 40% of adults get their flu vaccine. This year, the CDC is hoping for over 70%, so double of what normally people do. And in fact, I'm hoping for closer than 100% because we really need a lot of people not to get the flu in order to be able to handle this pandemic this winter. And then the third S reason for getting the flu vaccine, I call it the scientific reason. So, we're racing to get a vaccine for COVID-19. We really want to protect COVID-19. We already have a vaccine to prevent the flu. And the reason to get that vaccine scientifically is because when you get a vaccine against one virus, it actually revs up your immune system and activates it. It's almost like giving your immune system a little workout so that it's in better shape to fight other viruses. So in a way, getting a flu vaccine could inadvertently protect you against other respiratory viruses, including, of course, the COVID-19 infection. Now, the second thing you can do is to wear a mask, and you've heard this a million times, but the reason we keep saying it over and over again is because they work. If everybody wore a mask between now and January, 100,000 American lives would be saved that would otherwise be lost if we continue at the rate with which we're wearing masks. And I know we're tired, I know it's difficult, I know it's challenging, but we did it over the summer, and that's when it's even harder because the weather's warm and it's difficult to wear a mask for long periods of time. But now come winter, I'm really hoping that we all get on board with wearing the masks because it's one of the best things we can do, not just to decrease the incidence of COVID-19, but other respiratory infections as well. And now that we're in the winter, guess what we're all going to do? We're going to congregate indoors, right? We're not going to be able to sit outside and eat dinner when it's snowing. We're not necessarily going to be able to go for hikes. We're going to have to do more things indoors, and that increases the risk of transmission of COVID-19 by 19-fold. So it's 19 times higher risk of transmission indoors than outdoors. So wearing a mask doesn't just protect others from our droplets, it protects us from other people's droplets as well. So the wearer of the mask has a benefit as well. And there's actually scientific evidence showing that if you wear a mask, even if you get infected with COVID-19, the illness that you get is much milder. Now, this is the concept of what we call viral dose, which means the dose of the virus that you got was reduced because you were wearing the mask. So even if the virus sneaks by and a few particles get in, the majority of the dose was reduced because of the mask. So your illness may end up being milder. You may have a less severe version of COVID-19, even if, God forbid, you end up contracting it. So there's so many good reasons to wear a mask. Now, a lot of people are also asking me, well, if we're wearing masks and we're washing our hands and we're physically distancing and we're staying home if we're sick, isn't flu activity going to go down this year? And the answer is absolutely yes, it is going to go down. In fact, what we've seen in the Southern Hemisphere is that doing all these measures has really reduced the transmission of flu. So that's a great thing. But guess what? You still need to get that vaccine, because if you don't get it, and if everybody decides not to get it, flu is going to happen and flu is going to take off. So that's the worry, is that people say, oh, I don't need to get it this year because I'm staying home or because I'm washing my hands, I'm socially distancing. But that if everybody thought that way, then we would have a really bad situation on our hands. So this year, even though we do expect the flu to be a little bit better because of all the things we're doing, it's still very important. In fact, more important than ever to get the flu shot, because we're in the middle of a global pandemic. And then the other things on this list, of course, you already know, you want to wash your hands for those 20 seconds. It gets harder in the winter. We live in a dry climate here in Colorado. Your hands get cracked and things like that. But just make sure you moisturize afterwards, but keep washing those hands because that's really important.
Wow, that's a lot of really good information. Again, this is incredible. I did not realize that the masks also helped with the severity of COVID-19. So that's new news to me, and hopefully others on this call too. That's really good information. So as we're thinking about kind of moving forward, there's this new term that's come up for people. Tell me what coronaphobia is.
So this is very interesting. This is a phenomenon that just occurred in the last 6 months, as you know, because this virus didn't exist before that. But coronaphobia is really a fear of the coronavirus. And it encompasses two different elements. The first is an irrational fear of contracting the virus to the point that it's interfering with your life. And then the second is avoidance of people who've either had the coronavirus and recovered, or those who may have been exposed to the coronavirus or are at risk for coronavirus. So let me talk about each of those. So the first is the irrational fear of contracting coronavirus. And part of this, to be honest, was driven by the unknown. This happens anytime there's a new infection. It happened when HIV first came out in the 1980s, because guess what? We didn't know anything about it. We didn't know how it spreads. We didn't know who's at risk. We didn't know how to protect ourselves. So there was this irrational fear that people had of contracting the coronavirus, and it led them to modify their behavior. So what's happened, for example, in the last 6 months, and what we've seen, me as a cardiologist, is that people are in the midst of a very massive heart attack, and yet they're not calling 911. They're not calling an ambulance. They're not leaving their homes because of this irrational fear that they have of contracting the coronavirus. And I think part of it is driven by the fact that early on in the pandemic, we really didn't know how the virus is spread, who's at risk, how to protect ourselves, all of those same things that I talked about when HIV first came out. But guess what? Now, 6 months later, we know all those things. We know so much more about this virus than we knew at the beginning of the pandemic, that we can protect ourselves. We do know how it's spread. We do know when it's safe and when it's not safe to leave our homes. And in an emergency, if we need to leave our home, or even for day-to-day activities like grocery shopping and going to the drugstore, we can do that in a safe manner. So I really want to reassure people that we need to dial down the coronaphobia, because if we keep delaying our care, keep delaying things that we need to do for our life's maintenance, such as preventive care, it can really lead to downstream effects that can be catastrophic. And in fact, what we've seen is many of those heart attack and stroke patients that didn't come to the hospital in a timely manner turned a small problem that we could have fixed right away by opening up the blood vessel, fixing the heart attack or fixing the stroke, into a big lifelong disability where they have permanent damage to the heart, or they have permanent disability from their stroke. Now, I'm giving you those extreme examples, but coronaphobia also applies to just day-to-day things. So some people have an aunt, for example, who hasn't left the house since March, since this all started. The only place she'll go is in a closed car, driving and not getting out. that is an example of coronaphobia to the point where it's probably impacting your mental health, impacting your ability to sort of cope with what's going on. And the reason we need to dial it back at this time, you guys, is because we're going to be in this mode now for the next 6 to 12 months. Initially, we had thought it was a short period of time, but by the time the vaccine comes out and everybody gets it, it's probably looking at about a year before we can go back to our lives as normal. So having this level of fear just generates a lot of anxiety. It's not good for our mental health. The second part of coronaphobia is avoidance of people who've had coronavirus and recovered. And I've seen this happen a lot as a physician, even in the medical community. If I have a patient who comes into the office and has had coronavirus 6 months ago or 3 months ago, people tend to avoid them a little bit. And I really want to reassure everybody, because I want to explain the science, that in fact, these people are even lower risk because they have antibodies against the virus. So if they've contracted the virus, they've recovered, and they're no longer infectious, they have those antibodies that is actually going to protect them from getting the virus again, at least for some period of time, more so than an average person. So if anything, they're slightly lower risk of giving you the virus. Now, the only caveat to that is if somebody's had a recent infection, like for example, a week ago, they could still be infectious. So then you obviously have to be a little bit more careful around that type of a person. But again, this is one of those things where we don't want to start shunning members of our community and our society. These are our family, our parents, our brothers and sisters, our children who are going to get this virus and recover. But it doesn't mean that, you know, they're now pariahs or you have to treat them in a different way, because this is just like the flu. This is how we should think about it. If somebody had the flu last year, you don't start avoiding them. And in the same way, we need to really dial back the coronaphobia with fear of others.
Perfect, thank you. I will remind everybody that's listening in, we do have that Q&A box open, so please put any questions you have as a follow-up when we do have some time dedicated at the end. So next, let's talk a little bit about long-term effects. I know we've all heard different things through our different channels of getting information. What are the long-term effects of COVID-19 if you contract it?
Well, you know, we're just starting to get some information on that because this virus just, you know, broke on the scene in December. So we're not even quite at a year yet, but already we're seeing that some people do have long-term sequelae of this virus. It's not really like a one and done thing, like a cold. You're over it and it's gone. A lot of people can have long-term symptoms, and these are called the long haulers. And there's actually now a research center at Mount Sinai dedicated to these long haulers. And we're learning a lot about these long haulers through the research center. What we're learning is that their median age is about 42. So they're pretty young. And the majority of them, in fact, about 80% are females. So females have a higher risk of being long haulers from COVID-19. We don't quite understand why that is. But there are many different ways in which you can have long-term consequences from COVID-19. So some that are frequently reported are shortness of breath, chest pain, and heart palpitations. So these are people that are sitting there that may have been completely functional before, normally living their lives, that all of a sudden are now to the point where they're getting winded walking to the bathroom or walking up one flight of stairs, or they're sitting there watching television and their heart suddenly starts racing. In fact, one of my patients is a long hauler. She's an ICU nurse, contracted the virus back in March, and now 6 months later, she's to the point where she gets severe fatigue. She's can't stand on her feet doing her 12-hour shifts anymore. She gets these heart palpitations for no reason at all. She gets shortness of breath, and it's a really difficult situation. So now if you ask me why this is occurring, we don't know why, but we have a few theories as to what might be happening. So people who have this constellation of symptoms, we worry that they've damaged their nervous system. We all have a nervous system in our neck that regulates our heart rate, regulates our blood pressure, kind of keeps, all of the automatic functions of our body running on its own, depending on what's happening. And there's some theories, this is called the autonomic nervous system. There's some theories that the coronavirus can damage the autonomic nervous system and basically mess up its set point. So it starts acting crazy or doing things for unpredictable reasons, like when you're sitting and watching TV, you don't really need your heart rate to be faster, as opposed to when you're climbing stairs, but instead of making your heart rate go up when you're climbing stairs, which helps you, it does it when you're watching TV, and it doesn't do it when you're climbing the stairs. So it kind of messes up the response of the autonomic nervous system. Now, there's also other studies that look at other organs that may have permanent or semi-permanent damage from COVID-19. So what we're seeing is that people can have damage to the heart muscle, which is called myocarditis, inflammation of the heart muscle that can occur even more than 2 months after their infection, even after they've recovered. And this can happen even in people who had a mild form of the infection. So there's a study in the Journal of the American Medical Association. People had a mild infection, 100 random people. It looked at them over 2 months later, and 60% of them had evidence of active inflammation in the heart 2 months after their infection, even if the original infection was mild. So that's part of what's prompted a lot of the changes in the NFL and the Big Ten with now doing cardiac screening for all athletes that have come down with COVID-19, because we're realizing it can affect the heart. It has receptors in the heart. There's also some data out of China that it can cause permanent damage to the lungs and affect people's ability to heal. Now, usually the lung damage is a function of how severe the initial infection was, because it's from scarring from the inflammation from the initial infection that can cause damage to the lungs. It can cause our hair to fall out. That's called telogen effluvium. And we're seeing a lot of people have that, and it's very distressing, where greater than 50% of their hair falls out. And it's really a stress response in the body that's leading to that. Thankfully, that's temporary. So a lot of people's hair grows back within another 6 months or a year, at least we hope it does. But it can be very distressing to have large amounts of hair falling out. So we're learning a lot about this virus, but what we're seeing is that it can have a lot of long-term effects on our organs. And that's why it really worries me when these college kids want to have these, COVID parties, so to speak, where they want to go catch the virus to get it over with, because we really don't know in who these long-term effects are going to occur and for how long they're going to last, if not for the rest of your life.
Thank you. So moving kind of into the vaccine talk a little bit more here. So we talked a little bit about the importance of the flu vaccine, which I think was really helpful for all of us to get reinforced. How about the COVID-19 vaccine? What do you know? What should we be aware of as it relates to that vaccine?
Yeah, so the COVID-19 vaccine has actually been a remarkable journey because really it's shown us that we can develop vaccines very quickly. Normally it takes about 10 years for vaccine development, sometimes up to 15 years, but at the minimum at least 4 or 5 years. And really you've seen the remarkable progress that we've made in the last several months in terms of taking vaccines and putting them into late stage trials. But the way we know that vaccines are safe, so we know that vaccines are safe, they prevent disease, and they can save lives. But the way that we know that vaccines are safe is because we put them through rigorous clinical trials. So there's 3 phases of clinical trials we do. Phase 1 is just a small trial to see if the vaccine, it causes any immediate safety signals that would, prevent it from being developed. Phase 2 is a little bit of a larger trial where we try to find the right dose and we try to find the right frequency. Do we need only 1 shot? Do we need a booster shot? Etc. And phase 3 is really where we get the meat of our data. So that's where we answer 2 big questions. First, is the vaccine safe, which is the most important question. And second, does it work? So both of those questions need to be answered in phase 3, and that's where we try to enroll a diverse population in phase 3, really the type of people that are going to get the vaccine. Now, you may be wondering about kids. We generally don't do clinical trials on kids for vaccines, and we extrapolate the data that we get from adults into kids because we don't really want to, experiment on our kids when it comes to vaccines. But we don't release vaccines until we know that they're safe. So I really want to reassure people that the scientific process is intended to protect everybody. Now, of course, politics enters into everything, and we've seen the injection of politics in the discussions of vaccines and all such of those things. But in my opinion, without rigorous phase 3 clinical trial data, I would not feel comfortable giving myself, my family, or my patients the COVID vaccine. On the other hand, if we do have good phase 3 clinical trial data, regardless of how long it took us to get that data, so even if we get it in the next 2 or 3 months, and it shows that the vaccine works and that it's safe, those are those 2 big questions, I would feel comfortable giving this to my family and taking it myself. So I think we just have to let the scientific process kind of carry itself out. The COVID-19 vaccines that are being developed are a brand new technology. So they're called messenger RNA vaccines, which means they inject the genetic material of the virus into you in order for your body to make the viral proteins and based off that genetic material, and then your immune system to learn how to fight those viral proteins. So you can't get sick from the COVID-19 vaccine, which is a great thing. But those safety signals that we watch for are things like autoimmune reactions. So when we rev up the immune system, sometimes it can overreact and start attacking our own body. And that's what that one case where they had to stop the AstraZeneca vaccine because of transverse myelitis was inflammation in the spinal cord that maybe have occurred from the immune system getting revved up. Now, we don't know yet if that one case was the placebo or the active vaccine, because they could have just had transverse myelitis from something else, from their genetics or from some other exposure. But those are the types of things that we watch for in terms of safety signals. Now, let's switch gears and talk a little bit about the flu vaccine, because I do think it's important, again, for us to get all of our kids vaccinated this year. And the CDC is saying if you're greater than the age of 6 months, you should get a flu vaccine. If you're under the age of 9, so if you have a child under the age of 9 who's not had the flu vaccine at least twice before, then you actually need to give them 2 doses in the same season, separated by a month. So this is something a lot of parents don't know, but if your child is under the age of 9, has not had 2 doses of the flu vaccine, they need an initial dose and a booster dose separated by a month. If they're over the age of 9, they just get a single dose, just like adults do. There's also many different types of flu vaccines, and this is another thing that a lot of people aren't aware of. People think there's just one flu vaccine. There's actually several different types. There's the trivalent, which has 3 strains of the flu, the quadrivalent, which has 4 strains of the flu. There's a quadrivalent with adjuvant, which is 4 strains of the flu, plus a protein that kind of revs up the immune system even more. That's intended for older people over the age of 65. And then there's also egg-free formulations for kids or adults who may have specific food allergies. All of these vaccines that I talked about are inactivated, so you can't get the flu from these vaccines. However, there is a live vaccine for the flu, and this is something you should be aware of, because a lot of people that are afraid of needles, or if they have a child that doesn't want a shot in the arm, use the intranasal vaccine, which is called the flu mist. And that's actually a live attenuated, so weakened, diluted form of the actual flu that you're injecting into your nose there. And I don't recommend getting that, even though it is available, for a few reasons. The first is you could potentially get sick from it, because we're actually giving a live vaccine, so you or your child could get sick from the flu mist. The risk is small, but it's still not zero. The second is that in 2009, the flu mist actually didn't work very well for H1N1. And now since then, they've reformulated it and they said it's working a little bit better. But in addition to potentially exposing you to the virus, it doesn't work as well as the inactivated, the shot in the arm that I'm talking about. So even though needles are scary, especially for children, I would strongly encourage you to really get your child the shot in the arm or the shot in the leg, if that's possible, instead of the flu mist this year.
Perfect, thank you. So the next question is, who should get the COVID-19 antibody test?
Now, a lot of people are asking this, and we have so many different tests out there that it gets a little bit confusing. So there's, of course, the active COVID-19 PCR test, polymerase chain reaction. That's the swab in the nose to see if you have infection today, if you're actively infected. So that looks in the present. The COVID-19 antibody test looks in the past. So it doesn't tell me whether you're infected today. It tells me whether you were infected at least 2 weeks ago or more. So it looks for antibodies, which is a marker in the immune system. It's a protein that tells us that your immune system has seen this infection before. So, you know, the COVID-19 antibody test is a little bit interesting, because it's going to tell us what the virus has done, what the landscape of the virus looks like over the last several months. Because a lot of people, as we talked about, don't have symptoms. So many of them may not even realize that they were exposed or infected with COVID-19. So it's not for everybody. The antibody test is not recommended for everybody, because if you have a low likelihood of having had the virus, then the antibody test coming back positive is more likely to be a false positive, meaning it's the wrong answer, rather than a true positive. So there's certain groups that should get the COVID-19 antibody test. So if you're somebody who had symptoms, but didn't get a viral PCR test, that swab in the nose, then you may want to know if you've already been exposed to the virus and your body has mounted an immune response, then you should get the COVID-19 antibody test. Now, the sweet spot window for getting it seems to be about 2 to 8 weeks after symptoms that you had, because it takes at least 2 weeks for those antibodies to start to go up so that they're detectable. And some studies are showing that after about 8 weeks, they can start to wane. So that's the downside of COVID-19. It looks like it's not something where your immunity lasts forever. it may start to go down as early as 2 months after the infection. And we've obviously heard about some cases of reinfection occurring because of that reason, because the antibodies can wane after some time. So the sweet spot seems to be 2 to 8 weeks after you think you may have some symptoms that could be COVID-19. If you've had a known exposure to COVID-19, and again, you didn't develop any symptoms, but you think you may have had an asymptomatic infection and didn't get tested, that's somebody who should get a COVID-19 antibody test. If you're an essential worker, like a healthcare worker, a frontline worker, anyone who's had a lot of contacts during the pandemic, has not had the luxury of being able to work from home, then you may have been inadvertently exposed and you were asymptomatic and you didn't realize it. And then finally, the last reason is if you think you might want to donate your plasma, if you think you might have had the infection and you want to give your antibodies to somebody else, because convalescent plasma, using antibodies from one person and injecting them into the other, is being studied as a promising treatment for COVID-19 infection. So if you think you want to get the antibody test, you can get tested through 9Health Fair. You can go to 9healthfair.org and sign up for the COVID-19 antibody test there. Now keep in mind that there are different types of antibody tests. They're not all created equal. And coronavirus is a family of many different viruses that can cause the common cold, for example. So if you have a bad test, a bad COVID antibody test, it could come out positive, not because you had SARS-CoV-2, which is the coronavirus that causes COVID-19, but because you had a different coronavirus 5-6 years ago, one that causes the common cold, and you still have antibodies. So it's important to get an antibody test that performs well, because you don't want that cross-reactivity. You don't want that false positive, and you don't want that reassurance thinking that you've had COVID-19 and that you have antibodies, when in fact those antibodies are against a different coronavirus and just cross-reacting on the COVID-19 antibody test. Now, in general, if you have antibodies to an infection, that usually means that you're immune or protected. With COVID-19, the CDC has been extremely careful with saying that people have protection. They're not saying this is what we call an immunity passport, meaning you can run around and you don't have to worry about contracting it. Again, for that reason, because we're seeing that antibodies can start to go down as early as 2 months, and different people have different antibody responses. So some of what's being found is that the amount of antibodies you make may be a function of how severe your infection was. So if you're one of those people that had the asymptomatic infection, your antibody titers may be a lot lower than somebody who had a severe form of the infection. So there's so many unknowns about what the antibody means, how long it lasts, whether it's the right type of antibody that's made, that we don't say that an antibody test is an immunity passport, meaning that you're protected from future infections.
Great, thank you. So I do want to remind all of our audience that we are going to be moving into audience Q&A here in a second. I know we have a couple questions queued up, but if anybody else has questions, feel free to pop those in now. Our last formal question is, why are preventative health screenings like the ones 9Health offers so important?
So, you guys, we've always been talking about flattening the curve of the pandemic. And what curve we're referring to is the curve of COVID-19 infections, right? And we've all done a great job of flattening that by wearing masks, washing our hands, and keeping our distance. But what we're not realizing is that many other curves of morbidity and mortality that are emerging from this pandemic, not just that first curve of COVID-19 infections, but that second curve of people not getting their heart attack treated and not getting their stroke treated. The third curve of people not taking care of their chronic health problems like diabetes or heart disease or high blood pressure, atrial fibrillation, cancer being missed because you're not getting your preventive health screenings. This is going to be the third curve, which won't really manifest itself for at least a year, because these are preventive health things that we would otherwise have normally done that we either put off or forgot to do, even something as simple as dental cleanings, for example. And the consequences of this will take several months to a year to start to manifest itself. So those curves we're not going to start to see until next year. So the last thing we want to do is to flatten the first curve, which is the COVID-19 infections, at the expense of allowing the other curves to steepen. So we really need to think of in a different mindset that we're going to flatten all the curves of this pandemic. We're going to flatten all the fallout from this pandemic. And the big part of that is to get our preventive health screenings. Now, back in March, we were telling people to stay home, not get their screenings, because again, we didn't know much about the virus. We didn't want to expose people without knowing what we're dealing with. Now, at this point, we have a much better handle on how the virus spreads, and we're living alongside the virus is really how I want everybody to think about this. So now is the time to go out there and make sure you're staying on top of your preventive health screenings. Do it in a way that minimizes your risk. So if you're in a high risk group, have a virtual visit with your doctor. Try to figure out ways where you can, go to a service center to get your blood drawn, so that it's very early in the morning when they first open, you have an appointment, you're in and out, you're wearing your mask, they're wearing their mask, and it's a quick thing that exposes you to minimal risk. So, know that preventive health can help you to stay healthy, and it helps you to know your risk for chronic disease. And we don't want to miss a cancer, because if we catch a cancer today, it could mean the difference between life and death, as opposed to waiting a year when this pandemic is over and doing your cancer screenings then. So if you're behind on any of those cancer screenings, set up a telehealth visit with your doctor and see what you need to get done. And of course, we all know that preventive health also reduces healthcare costs and unburdens the system. So it's really important to do all year round, not just, during a pandemic, but at any point, preventive health should be paramount. So, if you haven't gotten your preventive health screenings, then you can go to 9healthcare.org and sign up for a low-cost preventive health screening. There are a few different ways you can get it. We are having some fall fairs this year, where you can go in person and get your blood drawn. But if you're not comfortable going into a fair, then the patient service centers at Quest are also offering these preventive screenings every day of the week. And like I said, just go in at a time first thing in the morning, quickly get your blood drawn and get in and get out. So there are measures you can do to keep your preventive health safe. I will say that we do have a fall health fair coming up this weekend on October 3rd. Make an appointment, because this year we're doing fairs with appointments only because of the pandemic, and you can get your preventive health screenings there. You can also get a free flu voucher. So we've talked a lot about flu today. So if you haven't gotten your flu shot yet, then now is the time to get it. Now is the perfect window, in fact, because you don't want to wait too long, because then you're not going to get the bang for your buck. So October 1st is when I tell my patients to get it, and that's tomorrow. So it's the perfect time to get your flu shot if you haven't gotten it yet. So thank you so much for your attention this morning, and I hope you have some questions that I can answer for you today.
Yes, there are a few that have come in. I'm going to pass the torch to the Arvada Chamber's Marketing Director, Ryan Heck, to share those questions with you.
Thank you, Cami, and thank you, Dr. Kohli, for joining us this morning. We do have some questions in the chat. If you can please put those in the Q&A portion of the webinar, that will help us kind of facilitate those questions. So first question from Rita: when feeling under the weather, what should we stay home for, and what is okay to be out with?
I think at this point, Rita, if you're feeling under the weather, you need to stay home, because there's really nothing you should be out for. Now, it is confounded a little bit because we've been having the wildfires. So if you're a little stuffy in the nose, you're a little itchy in the eyes, your throat's a little scratchy, it's hard to tell, is it allergies, is it reaction to wildfire, or what have you. But if you have any real symptoms, I would say, which include fever, and that's even a low-grade fever. It doesn't have to be 100.4 in my book, even if you're 99.5 or 99.7, something like that. If you have any kind of systemic symptoms like muscle aches, pains, feeling just like you want to stay in bed, of course, if you have a cough or if you have shortness of breath, those are kind of red flags for COVID. But because COVID can present so differently in so many different people, I would say it's best to err on the side of caution. If you have any symptoms, my advice would be stay home. Try to get a test if you can, because it's really helpful to know, because if you're COVID-19 negative and it's just a cold, then you probably are okay, to wear your mask and go out if you need to go out. But in general, the advice of public health experts, any symptoms, even if mild, stay home until they resolve.
Thank you. We have a fairly similar question related to symptoms. If you could speak on the difference of kind of the initial symptoms of COVID versus the flu, and kind of what to look out for.
So the one thing with the flu is the incubation period is a little bit shorter. So what that means is that from exposure to the time that you present is a little bit shorter. So the flu also generally tends to hit you like a ton of bricks. So it kind of just comes out of the blue. You wake up one day, you can have the systemic symptoms like muscle aches or pains, malaise, like I said, feeling like you just want to lie in bed, nausea, not wanting to eat or drink anything. Fever, of course, is a big one. And then some people can also obviously have a cough, have a little bit of a sore throat. Shortness of breath tends to be less likely with the flu. On the other hand, with COVID, the incubation period is a little bit longer and the symptoms are much more variable. So what I mean by that is from exposure to the time of infection for the flu is about a day or two. For COVID-19, it's 5 days. So sometimes they can be a little more gradual in onset. They do include, for some people, a lot of the systemic symptoms. So if you're one of those people that's going to get a fever with COVID-19, you probably will feel like you have the flu. You'll have a lot of those systemic symptoms of muscle aches and pains, malaise. And again, those are coming from the immune system being activated. So if you have a fever, you're probably going to have those systemic symptoms. But if you're one of those that has COVID-19 with a milder form, you could have something as simple as loss of taste or smell. We're finding that that's a symptom of COVID-19 in some people. For some people, they just have a little bit of sniffles or a little bit of a sore throat. They don't really get that shortness of breath way down in the chest. And so for some people, the COVID-19 symptoms can be really mild. If you have any fever, any muscle aches, any systemic symptoms, if you're feeling malaise, you stay away from other people, you get your COVID-19 and flu test. I would recommend both tests as we're heading into the flu season. And you make sure that, you're watching out for signs of decompensation that might make you go to a hospital, like not being able to eat or drink, getting confused, having severe shortness of breath, or having your oxygen levels go down below 90% if you have a pulse oximeter.
Great, thank you. Next question here from Ed, and this is very relevant for our business owners and the business community. From Ed, as an employer, what documentation is needed upon the return of a positively tested employee, and what guidance can you give regarding timing and symptoms?
Yeah, that's a great question, Anne, and I actually had a medical assistant in the same situation recently. So I would say if somebody's actually been infected with coronavirus, then the CDC recommends one of two strategies. One is the symptom-based strategy, so at least 72 hours since the last symptom, including fever. I don't favor that, to be honest. My opinion is if you want to protect yourself as an employer, it's better to use a test-based strategy to return people to work. So what that means is that you get them a COVID-19 test that's negative, ideally 2 COVID-19 tests that are negative, spaced 24 hours apart. So if they got infected on the 1st, you let their infection play itself out. Usually about 10 to 14 days after, you get them tested. If that test comes out negative, you want to wait 24 hours, get them tested again. Both of those tests are negative. They can safely return to work because they've cleared their infection. And I think that's a safer strategy in general because, like I said, symptoms can be variable in people. So some people could still be infectious, but have had resolution of their symptoms. And that's what I always worry about. You don't want to infect other people at work, and obviously you don't want to infect your customers. So I like to use a test-based strategy to return people to work. If you can't get 2 tests, then at least having 1 and having documentation of that negative test in your paperwork is really important to return your employee to work.
Great, thank you so much. I know, Dr. Kohli, you have a hard stop at 8:45, so we'd love to answer one more question while we have you.
Sure.
As we look towards the holidays, we're talking about travel, and we're thinking about travel, and we have a really good question here. Is a mask enough to stay protected on an airplane? And then once you get to your destination, should you do anything to keep others safe after getting off the plane besides wearing a mask?
This is a really great question, and the answer is no, a mask is not enough. So of course airplanes are turning out to be safer than we thought for many reasons because they're filtering the air. They actually kind of recirculate, they get rid of all the recirculated air every few minutes. But you realize you're sitting in a small closed space. Social distancing is hard. People are coughing, breathing, what have you. So I would say if you're going on a flight, I would not just wear a mask, but also wear a face shield. I know it's difficult to do, but it protects all your portals because we're learning that COVID-19, in fact, on planes can get in through the eyes. And that's one of the ways that people have become infected on planes. So even if you're wearing the mask that covers your mouth and nose, it can still get in through your eyes. So if you've got the mask and you've got a face shield, that's usually pretty good protection. If you're in a high risk group and you need to travel, I would say don't just wear a simple surgical mask, go get an N95. That's a medical grade mask. You usually need to get fitted for it, but that's much more protective than a surgical mask in terms of preventing things from getting in and also preventing things from getting out. It fits tighter to your face. And that's what the medical providers wear when they're interacting with COVID-19 patients. And then the other thing I would say to keep yourself and others safe, which the airlines seem to have started to do, is use of testing. So if everybody that gets on the plane gets tested half an hour before they get on the plane, guess what? You probably don't even need to wear all those things, because the likelihood that somebody is positive is extremely low. Now, the no test is perfect, so it's possible the test could have missed an infection, or it's early in the infection, so the test didn't pick it up. But testing is a great way for us to start to get back to our lives safely. And United Airlines, for example, for every passenger getting on its flight going to Hawaii, it's testing everybody with a rapid antigen test, which gives you results in 15 minutes, costs $5 to administer. And it's a great way to get people, cleared, so to speak, to get on that plane, so that when they get to Hawaii, they don't have to do that mandatory 14-day quarantine. And I would say for many of you who are business owners, this is a great way to get your employees back to work safely as well. So once these tests are available, and this month we're hearing from Abbott that they're doing a lot of production of the tests. By the end of the month, they should be available. You can buy them, they're $5 each. You collect the swab, you put it on a little card, you add the reagent, and you don't need any special equipment. Right then and there, within 15 minutes, it'll tell you whether your employee is positive or negative. And it's really a great way to keep employees and customers actually safe. It's cost effective, and it's as simple as doing a pregnancy test, because you don't need equipment. You can get your answer right there. So I think moving forward, if I had to guess over the next year, the way in which we're going to be able to get back to our lives as normal without that vaccine, and to keep ourselves safe in the winter as we're all congregating indoors, is to start using testing a lot more and use that rapid antigen testing.
Awesome. Thank you so much, Ryan. And thank you, Dr. Kohli. You are incredible, and what a wealth of knowledge you are. And we're so grateful that you spent a little bit of time with us this morning. I certainly learned a lot, and I know all of our attendees did as well. So we're grateful for you joining us, and I hope you have a great rest of your day. I do want to take a moment to thank all of you for joining us. We are going to share a little bit about some of our priorities as the Arvada Chamber around healthcare. Our board of directors set the vision that we want Arvada to have the healthiest workforce in all of Colorado. And so the reason we connected with 9Health originally is as part of that vision. And they're doing some really innovative things, which you can see in the chat box that Stephanie posted, is that they're getting ready to offer some small business packages around preventative screenings and health, with telehealth included in that. We're really excited to continue those conversations and determine ways that we can help promote that to our businesses. Additionally, we've launched what we call the Arvada Healthcare Alliance. We call it AHA for short, and we really do define it as our AHA moment. It's our goal to increase the access that everybody has to quality preventative healthcare, as well as lower the cost. We know that many of you are facing bills each year that are increasing by 10% or more in some cases, and we want to do what we can to support that. So we've really identified how we at a local level can partner with our providers to offer these types of benefits. When we think about who can benefit from this program, it's really businesses that are struggling, as I noted, with those premium increases every year. Those that are evaluating their model and where there's opportunities for change and innovation, and businesses that currently do not have healthcare coverage or benefits for your employees. And so we're thinking about those buckets as we build out this program. To kick this off, we did partner with Paladina Health to create a program that allows for direct primary care for our businesses and individuals that are part of the chamber. With Paladina, you can have full access to a DPC for $99 a month. What's exciting for us in this program is we see opportunity to grow it. So we will be looking at adding additional partners to that as we move forward, thinking vision and dental and chiropractic and behavioral health, to make sure that you do have the ability to solve your healthcare needs at a local level. So this is a big change for us as a chamber, but we're excited to go down this road and again drive towards Arvada having the healthiest workforce in all of Colorado. So we're incredibly grateful to the partners that are working with us, including 9Health, as well as Paladina, to make sure that those messages get out, that this matters, and it is important that we all think about our health moving forward. So that's what we had for you today. If you want to learn more about the Arvada Healthcare Alliance, or if you have questions on 9Health, we'd be happy to share those with you. We will be publishing this webinar after the event today, so look for it on social media, and we'll also be sending out an e-blast with it. So we hope that you share this wide with your network, because this is important information and we all want to stay healthy this fall. Again, big thank you to our partners at 9Health for joining us today and being part of our journey to educate our community on being healthy. Have a great day, everyone. Thank you.